Hello and welcome. Today we're diving into a common yet often unspoken condition affecting the male reproductive system, Balanoposthitis. This is an inflammation affecting both the glans penis and the foreskin, and understanding it is crucial for maintaining men's health. We'll cover everything from the causes and symptoms to diagnosis, treatment, and prevention. So, let's get started. Balanoposthitis is primarily caused by infections, but several factors can contribute. The most common culprits are bacterial infections, often stemming from poor hygiene. Fungal infections, especially Candida albicans, are also a frequent cause. Irritants like harsh soaps, detergents, spermicides, and even certain fabrics can trigger inflammation. Less commonly, sexually transmitted infections such as gonorrhea, chlamydia, or herpes simplex virus can be responsible. Pre-existing skin conditions like eczema or psoriasis can also increase the risk. Now, let's discuss the pathophysiology, or how this condition develops. When an irritant or infectious agent comes into contact with the glands and foreskin, it triggers an inflammatory response. This response involves the activation of immune cells, leading to redness, swelling, pain, and itching. In infections, the pathogen multiplies, further exacerbating the inflammation. If phimosis or tightness of the foreskin is present, it creates a warm, moist environment ideal for bacterial or fungal growth, compounding the problem. Balanoposthitis is a relatively common condition, although precise data is difficult to obtain due to underreporting. It affects males of all ages, but is more prevalent in uncircumcised individuals. Those with diabetes are also at higher risk due to impaired immune function and increased glucose levels in the urine, which promotes fungal growth. Poor hygiene practices, such as inadequate washing under the foreskin, significantly increase the likelihood of developing balanoposthitis. The signs and symptoms of balanoposthitis can vary in severity. Commonly, you'll see redness and swelling of the glands and foreskin. Pain or tenderness in the affected area is also typical. Itching is a frequent complaint, and a discharge, which may be thick, thin, or pus-like, could be present. Ulcerations or small sores might also appear in more severe cases. In some instances, there may be difficulty retracting the foreskin due to the swelling and inflammation. Diagnosing balanoposthitis typically involves a physical examination by a healthcare provider. They will assess the appearance of the glands and foreskin and inquire about your symptoms and medical history. A swab of the affected area may be taken for microscopic examination or culture to identify the specific infectious agent, such as bacteria or fungi. In some cases, blood tests may be ordered, especially if sexually transmitted infections are suspected or if the patient has diabetes. Balanoposthitis can be classified based on its cause. You have irritant balanoposthitis caused by irritants, infectious balanoposthitis arising from bacterial, fungal, or viral infections, succinate balanitis often seen in individuals with reactive arthritis, Zuhn's balanitis, a chronic inflammatory condition mainly affecting older uncircumcised men, and finally plasma cell balanitis, a rare benign condition that causes red or orange-colored patches on the glands. Treatment for balanoposthitis depends on the underlying cause. For irritant balanoposthitis, avoiding the offending agent and using mild, non-irritating cleansers is crucial. Topical corticosteroids may be prescribed to reduce inflammation. If an infection is present, antifungal creams or antibiotics will be necessary. For severe cases, oral medications may be required. Circumcision is sometimes considered as a last resort for recurrent or chronic cases, especially those associated with phimosis. Maintaining good hygiene is always essential. Preventing balanoposthitis largely involves maintaining good hygiene. Gently wash the penis daily with mild soap and water, ensuring that you retract the foreskin to clean underneath it. Dry the area thoroughly after washing. Avoid using harsh soaps, detergents, or spermicides that could irritate the skin. If you have diabetes, managing your blood sugar levels effectively is important. For those prone to fungal infections, avoiding tight-fitting underwear and wearing breathable fabrics can help. The prognosis for balanoposthitis is generally good with prompt and appropriate treatment. Most cases resolve completely within a few days or weeks. However, without treatment, the condition can become chronic or recurrent. Complications can include phimosis, paraphimosis, inability to return the foreskin to its normal position, and scarring. Recent research is focusing on the role of the microbiome in balanoposthitis and exploring new topical treatments. Understanding the specific types of bacteria and fungi involved could lead to more targeted and effective therapies in the future.